So here I'm going to talk about the steroid in the part of the pharmacology. And here we go to focus about the drug's name and the common indication or uses of steroid, common side effect, and also nursing implication or intervention. And also we will figure out the NCLEX tips. What are the common area NCLEX asks? Our body can produce the steroid, right? So this is the kidney. Top of the kidney, one gland is called adrenal gland. And the gland inside, it is called medulla. Outer layer is called cortex. The inner layer produce catecholamines. And this catecholamines basically adrenaline, noradrenaline, or epinephrine, norepinephrine. The outer layer here, they have three layers: glomerulosa, fasciculata, and reticularis. Together we call cortex layer. And these three layers secrete aldosterone, cortisol, and androgen. So in this picture, it is showing better. Three layers: inner medulla, and these three layers secrete aldosterone, cortisol, and androgen. So androgen here, you can see this is the sex steroid, like testosterone or estrogen or estradiol. And this layer, I mean cortisol, the major classes of steroid hormone, basically corticosteroid, like glucocorticoid or mineralocorticoid. Glucocorticoid contain cortisol and glucocorticoids, and mineralocorticoids contain the aldosterone and also mineralocorticoids. So also the ACTase secreted from anterior pituitary has an important role to regulate the steroid hormone. Here we go. We are going to focus the corticosteroid. Corticosteroid, the major group is, here we said, the glucocorticoid. Glucocorticoid again contain the cortisol and glucocorticoid. And also another one is called mineralocorticoid. All are steroid, different types. And mineralocorticoid basically subcategorized to aldosterone, and aldosterone a mineralocorticoid which helps to regulate the blood pressure. Whatever, let me read first. Corticosteroid, here majorly we talk about the glucocorticoids or mineralocorticoid. Adrenal cortex insufficiency. So this is the adrenal gland. Outer layer is called cortex, and outer layer secrete aldosterone, secrete corticosteroid, or they secrete the androgen like testosterone or estrogen. So if outer layer of the adrenal gland or cortex does not secrete all of the steroid hormone, we call adrenal cortex insufficiency, shortly called Addison disease, right? So the adrenal cortex insufficiency, two types: primary adrenal insufficiency and secondary adrenal insufficiency. If the pathology in the cortex area in suprarenal gland, this is the primary adrenal insufficiency. If the problem in anterior pituitary or problem in ACTH secretion and patient develop adrenal cortex insufficiency, it is called secondary adrenal insufficiency. And both together we call adrenal disorder. This is the picture you can see, top of the kidney, adrenal gland. What are the function of this gland? Adrenal gland help to make adrenaline and cortisone. Both of them is super important for management of the stress. So they helps to deal with stress, right? But if the cortex area does not produce this hormone or corticosteroid or mineralocorticoid, patient develop Addison disease, right? So from today, just keep in mind the spelling of Addison, Addison, D for down. So if the outer layer of adrenal gland decrease the secretion of hormone, steroid hormone, patient develop Addison disease. D for down, D for decrease, means Addison disease, too little secretion of steroid by adrenal cortex, outer layer, right? NCLEX board sometimes asks a question: if your patient have a Addison disease, educate your patient or the treatment option, replace the cortisol with cortisone or prednisolone by medication. Let me read it first. Primary adrenal insufficiency, also known as Addison disease. And Addison disease referred to hyposecretion of adrenal cortex. When adrenal cortex does not work well or hyposecretion, insufficiency, they does not produce their secretion or hormones like glucocorticoid less secretion, mineralocorticoid less secretion, or aldosterone less secretion. So when glucocorticoid secretion less, definitely cortisol secretion will be less, cortisol. So a cortisol means a glucocorticoid, and those function important role in immunosuppression. And also there's a mineralocorticoid here, especially aldosterone. a mineralocorticoid help us to regulate the blood pressure. How they regulate blood pressure? Through water and electrolyte balance, and also endogen. Basically, endogen contains testosterone and estrogen or estradiol is the sex hormone. So I said, if the hyposecretion of adrenal cortex, patient develop Addison disease. If hypersecretion, just opposite of this, we call Cushing syndrome, right? And keep in mind, Cushing syndrome means too much steroid hormone by adrenal cortex. So here, required the lifelong. So if anybody have a Addison disease or primary adrenal insufficiency, we educate our patient, they need require lifelong replacement of glucocorticoids like cortisone or prednisolone, and also possible of mineralocorticoid if significant hyposecretion occur. So secondary adrenal insufficiency, if we go this picture, secondary means the function or secretion of cortex, adrenal cortex or adrenal medulla controlled by ACTH, and ACTH secreted from anterior pituitary. Imagine a patient have developed some pathology or trauma or tumor in adrenal pituitary, and imbalance occur ACTH, and when imbalance occur in ACTH, it lead to malfunction of adrenal gland as well. So if the pathology here we call secondary adrenal insufficiency caused by hyposecretion of ACTH from anterior pituitary gland. Also, mineralocorticoid release is spread. In this picture, we can see the mineralocorticoid are used for replacement therapy in the primary or secondary adrenal insufficiency in case of Addison disease. Basically, the patient with Addison disease cannot handle the stress. Example, if they are told they need for the surgery, they faint. Means like you explain them they need a surgery, they easily get disturbed, emotionally disturbed. They do not know how to deal with the stress. So nursing care is very important. So in this picture, we are explaining the Addison disease, what happened. So adrenal gland not produce significant steroid hormone. When our adrenal gland does not produce enough steroid hormone, some signs symptoms develop, like hyperpigmentation of the skin, low blood pressure, weakness, and also the weight loss. As I told you, the steroid hormone like cortisol or glucocorticoid has an important function like immunosuppression. They play a role in the immunosuppression. Like aldosterone or mineralocorticoid helps to regulate blood pressure by water and electrolyte balance, and also the progesterone or testosterone help to develop and maintain the male secondary sex characteristics, also the estrogen which contribute to the development and maintenance of female secondary sex character. So when the imbalance or hyposecretion, all of the steroid, the normal function will be impaired. Like they said, blood pressure will be low, weakness, weight loss, and gastrointestinal like nausea, diarrhea, vomiting, constipation, and abdominal pain. And also intragumentary system develop vitiligo. Here showing the corticosteroid, especially we are going to focus mineralocorticoids. Basically, the drugs we use is called fluorocortisone. So mineralocorticoid are the steroid hormone that increase the reabsorption of sodium and chloride, and also promote the expel out potassium and hydrogen from the renal tubules, thereby helping and maintaining the fluid and electrolyte balance. And that leads to the regulate the blood pressure as well. So in this flow chart, we can see aldosterone, because aldosterone is a mineralocorticoid. They regulate the sodium level, they regulate the potassium level. What are the mechanisms? They stimulate the renal tubules to reabsorb sodium, and also they secrete the potassium into the urine and make a balance we call electrolyte balance. So what are the common side effects of mineralocorticoid or cortisol? NCLEX board like this question. They frequently ask the question from here. So the common drugs we use in the market, like prednisone or beclomethasone, or palmicort or esmacort, all are steroid. So the mineralocorticoid or corticosteroid we used to suppress the inflammation. We use this medication orally or IV or inhaler form. The common side effect, basically patient develop sodium and water retention, so it leads to hypertension. Patient develop hypokalemia, means potassium loss, or hypocalcemia, calcium loss. But hyperglycemia means blood sugar go up. If anybody use the steroid for a long time, they chance to develop osteoporosis. Osteoporosis means erosion of bones. So pathological fracture is more common, and also compression of fracture, weight gain, and heart failure. So what you could educate your patient. So if your patient have a diabetic and you saw the patient take mineralocorticoid or cortisone or prednisolone or beclomethasone or palmicort, you tell your patient they have to adjust the insulin level because steroid can cause hyperglycemia. Some patients also complain the mood change. Sometimes steroid increase the intraocular pressure, and major side effect, their immune system suppression occur. So easily infection can catch up them. Also delay wound healing. Sometimes patient develop the growth retardation, but most common here we are going to focus potassium level go down, we called hypokalemia, or calcium level go down, we call hypocalcemia. But blood pressure go up, we call hypertension. And also skin getting thin and patient develop acne. So what are the nursing intervention? Monitor the vital sign, monitor intake and output, also measurement the body weight, and also check for edema develop. Monitor electrolyte and calcium level because it lead to hypokalemia or hypocalcemia. Hypokalemia or hyperkalemia lead to cardiac dysrhythmia, and cardiac dysrhythmia lead to cardiac arrest. What next? So the client is instructed to take medication with food and milk, and also the client instructed to consume a high potassium diet because patient tends to develop hypokalemia. The client is instructed to report if any kind of illness like infection, fever, right? Because patient immune system suppression is more common. The client is instructed to notify healthcare provider if low blood pressure, weakness, cramping, palpitation, or change in the mental status, because mood changing also the side effect of steroid. The client is instructed to wear a medic alert bracelet. The client taking a corticosteroid is instructed not to stop the medication abruptly because this could result in the adrenal insufficiency. So it is very important when patient take the medication, steroid like corticosteroid, cortisone or prednisolone, educate them, don't stop suddenly. So if they stop it suddenly, patient chance to develop adrenal insufficiency. Now we are going to focus glucocorticoid or corticosteroid. Glucocorticoid measures basically affect the glucose, protein, and bones metabolism. So they cause the hyperglycemia, protein metabolism, and also bone metabolism. So if anybody take the glucocorticoid or cortisone for a long time, they chance to develop bones erosion, we call osteoporosis. So after the normal immune response and suppression, the inflammation, the produce anti-inflammatory or anti-allergic and anti-stress effect. So the steroid that used for suppress the inflammation, right? So also they have anti-inflammatory properties, anti-allergic properties, and also anti-stress effect. Glucocorticoid may be used as a replacement of adrenocortical insufficiency. Glucocorticoid are used for their anti-inflammatory and immunosuppressant effect, both short-term and long-term in the non endocrine disorder. So if you prescribe your patient for glucocorticoid, what we could educate them. So before to go the implication, I want to explain what are the common use of or indication of glucocorticoid. There are, we can categorize this indication by endocrine disorder or non-endocrine. The major role for endocrine disorder, replacement or supplementation therapy, also the feedback inhibition by ACTH. So replacement therapy for acute or chronic endogenous cortical insufficiency like adrenal disorder, Addison disease, or during or after surgical remove of pituitary or adrenal gland. Imagine a patient has overt secretion of adrenal gland because of adrenal tumor, and patient develop Cushing syndrome, and Cushing syndrome does not control by conservative therapy, and doctor decide to remove the adrenal gland. In that scenario, patient have to take lifelong steroid, right? Also some congenital adrenal hyperplasia. So adrenal gland is there, but the tissue does not work because of congenital error. In that case, definitely they have to use lifelong corticosteroid or glucocorticoid. What are the non-endocrine disorder? As I told you, steroid is a life-saving medication. There are so many indications of steroid. If any medication in this list not controlled by other as usual medication, we use the high dose of steroid, like respiratory distress, like asthma, COPD, sarcoidosis, or acute respiratory distress syndrome. Definitely the first line of medications is bronchodilator like salbutamol, albuterol, or we can also use other bronchodilator. But if they are not enough, we go for the steroid, because steroid has a anti-inflammatory properties, anti-allergic properties, and also they have a anti-stress effect. Cardiac disease, post-myocardial infarction, or renal, some nephrotic syndrome like glomerulonephritis. So glomerulonephritis, one of the important cause of renal failure, and steroid is a drug of choice. Some gastrointestinal disease like ulcerative colitis, Crohn's disease, or autoimmune hepatitis. Most common use for rheumatological disease like autoimmune disorder, SLE, systemic lupus nephritis, polymyalgic rheumatica, or cranial arteritis, vasculitis, also rheumatoid arthritis. Other neurological diseases like cerebral edema, steroid can reduce the edema. Some kind of skin disease like eczema, also tumor like Hodgkin lymphoma, even transplant patient, if organ rejection, immunosuppression patient also can use the steroid. So here we found some common drugs, name what we use as a corticosteroid or glucocorticoid, like betamethasone, corticosteroid, dexamethasone, hydrocortisone, methylprednisone, and also prednisone or prednisolone, and triaminolone. So basically, the betamethasone we use for bronchial asthma, right? And when you give this medication to the patient, like I'm going to talk about beclomethasone or betamethasone, it is the one of the corticosteroid. We use this for chronic bronchial asthma, and it is helps to produce surfactant in the lungs. Okay, so it is life-saving drugs. So what are the other steroid we use? Like prednisone or prednisolone, like Palmicort or Esmacort, right? So also hydrocortisone, dexamethasone as well. Here showing the corticosteroid or glucocorticoid side effect. As like mineralocorticoid, they also cause hyperglycemia. So if your patient have a diabetic, tell them to adjust the insulin level. Patient develop potassium level go down, hypokalemia. So we educate patient to take high potassium rich food. Also develop hypokalemia. If it is not treated, hypokalemia lead to dysarthria. Also bone erosion, we called osteoporosis. Sodium and fluid retention, it increase the blood volume, and blood volume increase lead to hypertension, weight gain and edema, mood switching, mood change. If anybody develop the glucocorticoid or corticosteroid for a long time, they develop the Cushing syndrome. And Cushing syndrome is a immunocompromised medical condition. So the patient who develop the Cushing syndrome, like they have a buffalo hump, extra fat accumulate back of the neck. They have a moon face. It was like this, but now look like this. And also truncal obesity. The two legs is thin, but this area accumulate fat. Increase the susceptibility to infection because they can cause the immunocompromised. So infection is more common. And so if you see the patient develop the Cushing syndrome as a side effect of steroid, we need to isolate the patient, means give them private room. Okay. So also it is important, never abrupt stop the taking the steroid. It is very important to educate our patient. What next? Other side effect, growth retardation in the children. Gastrointestinal irritation, peptic ulcer, or pancreatitis, inflammation of the pancreas, or patient develop involuntary movement of muscle, we call seizure, or psychosis. What is psychosis? Psychosis usually occur with hydrocortisone and dexamethasone in the client receiving very high doses for a long time, and also most likely their effect on blood glucose level. So in this picture, we can see a bodybuilder. She took the steroid for a long time, but in later on, she developed the hirsutism. Hirsutism means excess body hair, and female develop the deep voice and look like the man. And also you can see this picture, extra hair, facial hair, acne developed, and also patient develop the, in case of men, they develop gynecomastia, and patient increase the intraocular pressure. Also high blood pressure develop. Adrenal insufficiency also. In this picture, we can see, just review little bit, the side effect and adverse effect of steroid occur with prolonged use of high dose of steroid. Patient develop Cushing disease. And I say Cushing syndrome or disease is too much steroid hormone, or I mean steroid hormone by adrenal gland, or patient use the corticosteroid or glucocorticoid for a long time. Some of the patients have a problem of psychiatric, like sleep disturbance, mood disturbance, or psychosis develop. Skin and soft tissue injury, like abdominal striae, acne, hirsutism, and edema. Neurological problem like neuropathy and cardiovascular, increase the blood pressure, we call hypertension. Musculoskeletal, erosion of the bones, fracture bones easily, broken bones because of osteoporosis. Also myopathy. Endocrine, patient develop hyperglycemia, we call diabetic mellitus, or adrenal cortex suppression. Immune system, immunocytopenia or immunosuppression. So immune system going to compromised. So infection is more common, and we need to isolate the patient if they have an infection, fever, right? Also ophthalmic, patient develop cataract and growth retardation in case of children. So now, contraindication in the client with hypersensitivity, psychosis, and fungal infections. So here we are going, what are the contraindication and what are the precursor we have to follow, and should be used with some precursor in the client with a diabetic. So if you know your patient have a diabetic, before to give the steroid, educate them and how to manage and adjust the insulin. Use with extreme caution in the client with infection, because they marks or the sign and symptom of infection, it is very important to measure. Increase the potency of medication taken concurrently, such as aspirin or NSAID, non-steroidal anti-inflammatory drugs. Thus, increase the risk of gastrointestinal bleeding or ulceration. So, NSAID or any other aspirin, it is good not to take with steroid. Also, use of potassium wasting diuretics. They increase the potassium loss and resulting in hypokalemia. So steroid and potassium wasting diuretics not to give together. Dexamethasone decrease the effect of oral administration, also anticoagulant or anti-diabetic agents. Barbiturate or anti-seizure medication phenytoin or anti-TB drug rifampin decrease the effect of prednisolone. So now I'm going to talk about the intervention. So nursing implication is super important, or nursing care. So if your patient undertake of the steroid, we regularly monitor the vital sign, also monitor the serum electrolyte, and because patient develop hypokalemia, which is lead to dysarrhythmia, or blood glucose level need to monitor. So monitor the hypokalemia and hyperglycemia, monitor intake and output, measurement body weight, and also regular measurement the vital sign like blood pressure, because patient chance to develop hypertension. Check the medical history for glaucoma, cataract, peptic ulcer, mental health disorder, or diabetic mellitus. Monitor for older client for sign and symptom that increase the osteoporosis. Check for change in muscle strength. Prepare the schedule for the client with information on short-term taper doses. So if need to stop the medication, we never stop suddenly or abruptly stop taking steroid. So teach the client to taper the dose drug off. What else? What are the other intervention? So the client is instructed that it is best to take the medication in the early morning with some food or milk. The client is advised to eat food high in potassium to avoid hypokalemia. The client is instructed to avoid individuals with respiratory infection. Avoid. Why? Because who use the steroid for a long time chance to develop immunocompromised. So they easily catch up the infection. Better to avoid the public place. Also, the client is instructed to inform healthcare provider for medication regimen. The client is instructed to report the sign and symptom of medication overdose, or if they develop the Cushing syndrome. Cushing syndrome including the moon face, or puffy eyelid, or edema on the feet, increase the bruising easily, chance to dizziness, bleeding, or menstrual irregularities, right? So to administer with the food is super important for NCLEX goat. So the client teaching, very important. As I told you, taper dose is important. Wear the medic alert bracelet, avoid the stress, or report if they have a fever or weight gain. Monitor frequent weight. It is very important. Increase the potassium and protein in their daily diet. Also monitor the blood glucose level. Even it is very important, raise the mouth after use of inhaler steroid to avoid oral thrush. Let me read one more time here. So note that the client may need additional dose during period of stress, such as any kind of surgical operation, because the patient fight to deal with the stress. Because this is the adrenal gland or adrenaline help us to deal with stress. The client is instructed not to stop the medication suddenly or abruptly because abrupt withdrawal can result of severe adrenal insufficiency, and this is the life-threatening condition. The client is advised to consult with healthcare provider before receiving the vaccination, especially live attenuated vaccine. So this should not be administered to the client taking glucocorticoid. And finally, here, the client is advised to wear a medical alert bracelet. And that is more than enough for steroid for NCLEX board exam.